Hi guys, and welcome back to my channel. Thank you guys so much for tuning in to yet another video. If you're new here, my name is Nadine and I'm a qualified midwife here working in the UK. So you guys have enjoyed the previous clinical video that I uploaded. If you have not seen that video, please make sure you go and check it out. So in the previous video, I filmed a quick tutorial on how to prepare IV fluids. So in today's video, I'll be showing you how to prepare IV medication. More specifically, I'll be showing you guys how to prepare IV antibiotics. So these antibiotics are benpen, also known as benzylpenicillin, and these antibiotics are given to pregnant women who are either GBS positive and also PROM. On the screen, I will upload a quick definition of PROM and GBS and why women will need IV antibiotics during labor or while they are pregnant on the antenatal ward, while they're going through the induction process, etc. So I hope this video is helpful to you guys. If you guys have enjoyed all my clinical videos, please do give this video a thumbs up, subscribe to the channel, leave the comments below as I do read them. But without further ado guys, let's get started with today's video. Okay, so let's talk about what I'll need in order to prepare my IV antibiotics. So the first thing that I have on my clinical table is my apron. Super important. If I'm doing anything clinical, I need to make sure that I have my apron ready to go. The next thing that is super important is a pair of gloves. Clean gloves. They don't have to be sterile, but I need a pair of gloves. The next thing on my list is a giving set. So if you guys have watched my previous video on how to prepare IV antibiotics, you guys would have seen this and why I choose this giving set in order to give IV antibiotics. So this is the giving set that I have chosen to give my IV antibiotics. But like I said in my previous video, different hospitals may use different giving sets or different equipment. So just familiarize yourself with what you have in your hospital and what you use in order to prepare your IV medication or your IV fluids. So the next thing that I have on my list is flush or saline in order to flush my cannula. So I just have 10 mils of normal saline. The next thing I have is water for injection. So water for injections, 10 mils, so in total 20 mils of water for injection in order for me to mix my antibiotics, because my antibiotics is in powder form. So for me to be able to mix it, I need to change it and make it into a liquid before I administer it to a patient. The next thing on my list that I need is syringes. So I have two 10 ml syringes so that I can draw up my medication and also my flush. The next thing on my list that I have is a drug label. So this is my drug label where I can label my medication or the bag when I administer the medication to a patient. This is very important. So if another midwife is taking over, if I'm handing over the patient, they can come and see which medication is running to the patient and everything is labeled and safe and effective as a midwife. The next thing that I have is a needle to be able to draw up my medication, and the next thing that I need is my bag of fluids where my medication will go into. So this all depends on the medication that you are giving, the strength, the dose. But for this dose that I'm about to show you, I will need a bag of fluids to be able to administer this medication. So the bag of fluids that I have is sodium chloride and it's in 100 ml bag. So 3 grams is what I have here in my hands. So I have one bottle that is 1.2 milligram, and I have another bottle that is 1.2 milligram, and then the third bottle is 600 milligram, which makes a total of 3 grams. So 3 grams is the prescribed medication that is being administered to this patient. So 3 grams of benzylpenicillin, so 1.2 milligram, 1.2 milligram and 600 milligram, making 3 grams. So that is what I then need to make my IV antibiotics. Okay, so let me give you guys a scenario of what we tend to do if we are giving benzopenicillin for a woman that is GBS positive, that has SHROMD, or a woman that is PROM and needs antibiotics. So the stat dose for a woman that needs IV antibiotics in those cases is 3 grams. So 3 grams of benpen is what is usually prescribed by the doctors for a stat dose, so a starting dose for a patient requiring benzopenicillin for those cases. So 3 grams is what I have here in my hands. So I have one bottle that is 1.2 milligrams, and I have another bottle that is 600 milligrams, and I have another bottle that is 600 milligrams. So in total, so altogether, that makes 3 grams, which is the dose that I require in order for me to give my stat dose for this patient. So what I then have to do is mix all 3 of these bottles together, and I'll be giving my patient the correct dose. So the stat dose for someone that is requiring benzopenicillin as a GBS or as a PROM, they need a 3 gram stat dose of benzopenicillin. But like I said, every hospital is different, every protocol, every policy is different. Please make sure you see what is required for your hospital. But the generic dose, which I have seen in multiple hospitals that they generally use, is the stat dose of benpen is 3 grams, which is why I have a bag of saline. So giving this as a bolus dose is very, very high, which is why I have my bag of sodium chloride where I can mix it into the bag and make it a little bit more diluted so it's not harsh on the vein, and I am not basically giving everything, all the 3 grams at once, which is why I have my bag of sodium chloride. But like I said, guys, every hospital is different. However you guys do your stat doses, whether you give it as a bolus, but in my hospital we give it in a bag of fluids as a 3 gram, and then obviously the continuous doses after you give your stat dose, then you can give as a bolus. So I'm basically showing you guys how to give a 3 gram benzopenicillin. Okay, so I got my apron on and ready to go, and the first and most important thing that you need to do is make sure you wash your hands if you are doing anything clinical. So I'm just going to pop my gloves on so I can start preparing my IV antibiotics. And what I'm going to do first is basically mix my antibiotics. So the antibiotics has a cap, so I'm just going to release the cap there and basically make sure that I'm not contaminating the top. Everything has to be aseptic. I have to make sure that I'm working in a very clean and aseptic manner so that I don't contaminate anything. So once I remove my cap, I make sure that I'm not disturbing the clean environment on top of the bottle. So the first thing that I then have to do is take my syringe, put my needle onto the syringe, so the needle is attached, and then I have my water for injections. So people do this differently, they may do it differently. You may see your mentors prepare IV antibiotics differently. Some midwives use water for injection in order for them to mix the IV antibiotics, and other midwives also use the water that's in here in order to mix the IV antibiotics. So what they'll do is basically insert the needle here, draw the fluid that's within the bag, put it in the syringe and mix it with the antibiotics. But I'm not going to do that. I'm going to basically use my water for injection in order to mix my IV antibiotics and then put the fluids in the fluid bag. But people can do it differently. You may see your mentors do things differently, but I'm going to show you how I use the water for injection in order to mix my medication. So making sure that everything is clean and aseptic, I'm going to remove the cap from my needle. As you can see, my needle is exposed. I am not touching it, I am not contaminating anything, and then I am going to draw up my water for injection. So I'm going to basically take the whole 10 mils of water for injection, making sure that I don't leave any gaps, any air bubbles, any space. So I'm going to make sure that it's all filled up to the top, as you can see there. So I'm going to put about I don't know, about 4 mils, 5 mils of water for injection in here, and then the rest I will split evenly in the smaller bottles of IV antibiotics. So then I'm going to pierce the top, making sure that my needle goes through all the way into the bottle, and then I'm going to insert the water for injection. As you can see, it has started to go in there. And then I'm going to shake. Give it a good shake. So what you can see your midwives do is remove the needle and then use it in the other bottles. But I'm going to keep the needle in the bottle here, so making sure that there's no cross-contamination. So I'm going to shake, 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 just to make sure that the powder has dissolved. As you can see, the powder has dissolved in this bottle of benzoyl penicillin. So I've removed the needle from the medication. As you can see, it's nicely liquefied. It's no longer in a powder form. So what I do now is take the second bottle of benzoyl penicillin. I remove the cap, exposing the top, and I basically start filling the bottle with my water for injection so that I can liquefy the powder form and make it into a liquid. And then I gave it a good shake, making sure that all the powder is dissolved. So that is my second bottle of 1.2 milligram of benpen. So I've got a little bit more water for injection to go into the next bottle. So what I'm going to do is remove any air bubbles, make sure that I've pushed all the fluids to the top, and I take my second bottle, remove the cap, make sure I do not contaminate the top, and also make sure that this part is also not contaminated, and I insert it into the bottle, and I basically push the rest of the fluids in there, and you basically mix, mix, mix. Okay, so my third bottle of antibiotics has been successfully mixed. It's now in liquid form. So all the powder has dissolved. So just to make sure that all the powder has gone before you start drawing up the medication. So I even had a little bit of water for injection left over. So what I'm going to do now is grab my first bottle of antibiotics. I'm going to basically put it upside down, which is a lot easier for when I'm drawing up medication. I'm going to insert my needle, put the needle right at the bottom, keep it upside down, which is easier for you so that you make sure you get every single drop of the antibiotics. Once it's upside down, the needle is in place, then you start drawing up your medication, pulling the syringe back, making sure that you get all the liquid. Yep. So nothing in there, nothing left. So I've drawn up the first bottle. So get rid of all my air bubbles, get rid of all of it. And then I take my second bottle of benpen that has been turned into a liquid. I put it upside down. I insert the needle into the bottle. I put the needle right at the bottom, and then I start collecting all of the medication back into my syringe, making sure that I get every single drop. So that is the second bottle of benzoyl penicillin 1.2. And I just basically repeat the same thing. So push, push, push up, making sure that all the air bubbles is gone. There's no space. Upside down. Insert my needle. Put my needle right at the bottom, and then draw up the antibiotic. Making sure that you get every last drop. And if you didn't get all the liquid, so you take the needle out, push all the liquid to the top, insert the needle again, and make sure that every single drop has been collected. So that's it. I've emptied out the 3 bottles of antibiotics. So 3 grams of benzoyl penicillin is here in the syringe. So my next thing that I'm going to do is I'm going to insert this needle into this bag of fluids. So I'm not going to insert it into this part of the bag of fluids. I'm going to insert it into this part of the fluids where you can see like a sponge kind of material. That's where the needle will go. So here is where my giving set will go. So I'm going to leave that closed right until the end. I am not going to open it and expose it to contamination or anything else. I'm going to keep that closed. So I'm going to insert my antibiotics through here. So this is the part where you have to be careful. As a student, one time I inserted the needle and it came through the other side and it basically pricked me. So you have to be very, very careful when you are doing this part as a student or as a midwife. So insert through the bag. It's going to be tough, but you literally have to just push through. As you can see, pushed through. The needle has gone through the bag. And then I'm going to push all the antibiotics in there. I don't know if you guys can see that correctly. All the antibiotics is being pushed in the bag. And then I'm going to take my needle out. And then I'm going to get rid of this needle. I'm going to put it in my sharps bin. Do not leave your needles laying around on the table. Make sure you get rid of all your needles as soon as you're done using them. So I won't be using this again. So I'm going to literally put this in the sharps bin so that I'm working in a safe environment. So once my medication has gone into the bag, I'm just going to give it a good shake. Good shake. Checking the bag, making sure that all is well. So after my antibiotics has been successfully mixed into my IV bag, I'm then going to complete this drug label. So I don't know if you guys can see. I'm just going to get up close. So it says patient name, drug or fluid, the amount, and then obviously the 2 midwives that have checked it. Whenever you're doing anything IV antibiotics, like I said in my previous video, it has to be checked by another qualified member. So another midwife has to also check your antibiotics, making sure that it's the right dose that you are about to administer, making sure that it's within date, there's no concerns with the medication that you are about to give. So I will basically hand this to a midwife so that she can check that I've got the right dose, the right medication, it's within dates, and that there's no concerns with the medication that I'm about to administer. And she will also check my IV bag, making sure that it's within date, I have the right bag of fluids. Everything is basically checked with another midwife, and I also do my own checks, making sure that I have the right bag, right medication, it's within dates, there's nothing wrong with the bag, there's nothing floating in the bag. I said this all in my previous video. Please do go and check that out as I go into more detail on what to do when checking for IV medication or IV fluids. So once I do that, I start filling in this drug label. So patient name, so I'm just going to say Alison D. I'm just going to put Alison D just for the sake of it. And then I'm going to put the drug is benzopenicillin, 3 grams, and the amount is in a 100 ml bag of sodium chloride. So I'm going to write that there, and then I'm going to sign here where it says prepped by. So it was prepped by me, so I'm going to basically put my signature here, and then the second midwife that checked this alongside me will be putting their signature here, so they will basically sign as well. And then obviously I need to put the prepped date and time. So I prepped this on the 20th of February 2024 at 9 AM. Okay, so date and time is there, and then I'm going to basically rip this apart, take the sticker off like so, and then I'm going to stick this onto the clear side of my bag. So I'm not going to stick it onto where the writing is, just in case someone needs to get to the writing and read the writing, I'm going to stick it to the back of the bag. So that's basically where I've stuck it. And then obviously this last bit that I ripped apart from the label, I will also do the same thing. So it says here, I don't know if you guys can see that. There we go. So it says drug, date and time. So I'm going to basically do the same thing. So I'm going to put benzopenicillin, 3 grams. Date is the 20th of February 2024 and it's 9 a.m. that I prepared it. That will go on the drip line. So my giving set, this will go on my giving set, so the actual line. So that there's one on the bag and there's one on the line as well. So after I've prepared my antibiotics and it's in the bag, I will now start preparing my giving set. So I will remove the giving set from the bag that it was contained in. As you can see, this is the giving set. It has the top here, which is covered, which is the needle that pierces the bag. It has the connector here where you can start the fluid, open and close the fluid, and also your giving set line or your pipe or whatever you guys call that part, and the end, which has also a cap, which I remove once I'm about to connect this end of the line to the patient's cannula. So what I do first is I remove the top of here. So I just gave it a twist and that basically comes off, making sure that I don't contaminate the area. Then I remove the top end of the giving set, exposing the very sharp end of the giving set, also making sure that I don't contaminate the two ends, because this is what's going to be attached to the bag and also running through the bag and the drip and the line and going to the patient. So you don't want to cross-contaminate and introduce any infection. So what I'm going to do then is pierce the bag or the needle into the bag. So I'm just going to twist and add some force until that goes right into the bag. So it's right in the bag, like so. Before I put it upside down, I need to make sure that the valve is closed. So what I do is I close the valve and then I put it upside down. As you can see, there's nothing running because the valve is closed. And my trick that I showed you guys in my previous video is what I do is I squeeze this part, making sure that the fluid fills up. Once I've got the fluid like kind of halfway, then I will open the bag and then I'll start running the fluids through. And as you can see, the fluid will start running through the giving set until it goes all the way till the end. Once it goes all the way to the end, I then close it up again, inspecting my line, making sure that there is no air bubbles. And if there are any air bubbles, I need to make sure I get rid of those air bubbles before I attach it to the patient. So that's basically my bag prepped and ready to go. My line is secure, there's no air bubbles. I have checked my cannula. My patient's cannula is in situ, ready to go. So I put that up on my giving set and then I prepare my flush before I start my IV antibiotics. So with my flush, I use saline to be able to flush my cannula, and this is where my other 10ml syringe comes into play. So I get my other 10ml syringe and I basically have to draw up my flush. So I attach my flush and my saline, making sure that I'm not cross-contaminating anything. Everything is still very clean. So I draw up my flush, get all that fluid out of the bottle, making sure that I get every last drop, and then I twist it off. I push all the saline all the way to the top, that there's no air bubbles, there's no gaps. As you can see, is nicely filled through. Once I have my flush ready to go, I have my cannula ready and the patient is sitting there ready. I've checked the patient, I've made sure that I've checked all the allergies. I'm giving the drug, the correct drug in the correct route. I'm making sure that the patient is aware as to why they're having the medication, and I'm also getting consent before I start the medication. The patient has the right to refuse. Once I've done all those checks, I then flush the cannula to make sure that the cannula is working. So I basically insert some, not all, some of this flush into the cannula just to make sure that it is working. Once I know it is working, then I will start my bag of IV fluids, and that's basically how I would prepare IV antibiotics for a patient if a patient is receiving benzylpenicillin as a stat dose of 3 grams. So I hope you guys have enjoyed this video, and I hope it has been very informative and very useful to you guys. If you guys have any questions, please do link them down below in the comment section. Also give this video a thumbs up if you guys have enjoyed it. But I'll see you guys in my next video, which will be hopefully very, very soon. But until then guys, bye for now.